Do you know that which all people have more tendency to get a low blood sugar or a hypoglycemia? Well, if not, then stay tuned with me because we are going to discuss that in today's topic. Namaste, my name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now, before I continue this video, one important information. If you want to watch this video in Hindi language, on I button and in the description box there is a link. If you click on that link, this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. आप जैसे ही वो लिंक पे क्लिक करेंगे इस वीडियो को आप हिंदी भाषा में पाएंगे. Now see, hypoglycemia or a low blood sugar is one of the very common side effect of a diabetes treatment. But which all diabetic individual has a higher tendency of getting a low blood sugar is an important point. Now, on an average, every diabetic individual who is under treatment can get a low blood sugar. However, low blood sugar happens to more those people who do not have enough and sufficient knowledge about their health. Yes, knowledge is power, and this applies very truly to all the diabetic related knowledge. So please make sure that you watch this video so that you get all the detailed information about what can cause a hypoglycemia. Now see, hypoglycemia can happen more depends on your type of a diabetes. Yes, if you have a type 1 diabetes, what in older time we used to call it as a juvenile diabetes, these people have a higher tendency of getting into low blood sugar. The reason behind that is that because type 1 diabetic individual have a higher glycemic variability. Glycemic variability in simple word is nothing but the fluctuations of your blood sugar. So if you have a very high glycemic variability, you can have a high type 1 diabetic people. So if you have a high glycemic variability, you can have a high chances of getting into low blood sugar. Similarly, if you are a type 2 diabetic individual and if you have a higher fluctuations in your blood sugars, again your chances of getting into hypoglycemia increases. Now, hypoglycemia also happens more commonly depends on your age. Yes, if your age is 65 or above or you are an elderly person, you tend to have a higher chances of a low blood sugar. Now, there is many reasons behind that. One such reason is that when you are in that advanced stage, many people have a cognitive dysfunction. Now, what is a cognitive dysfunction? It is about your mental alertness. So, when people have a cognitive dysfunction, they tend to forget things. They have a Alzeimbers disease, they have a dementia, and because of that, many a times they do a lot of mistakes while taking the medication. They take medicine and then they forget that they have taken medicine, so they take double the dose. Many a times they take medicine and after that they don't eat food on time, again that increases their risk. So this cognitive dysfunction people also have a habit of skipping meals and erratic food habits, so that can also increases their risk. Another reason with the elderly person is that they have some visual problem. Now see, elderly person due to their advanced stage have a eye problems like a cataract and glaucoma. Besides that, when you have a longer duration of a diabetes, you tend to have a damage in your retina part of your eyes, what we call it as a diabetic retinopathy, and because of that their vision gets impaired and they make a lot of mistakes, especially taking the insulin dosage. So if you have an elderly person and you fall in this age group criteria, you must take care. Also, these elderly people has a very poor social support at times. Now, what happens that with the new advancement in the medical facilities, the level and the life expectancy has increased. And many a time what happens, this elderly people stay alone. Maybe their children are staying separately, they are staying in other city or other country. Sometimes they have lost their spouse. So because of that, they do not have that much strong social support system, and because of that they are not able to manage their diabetes very easily, and this also increases their chance of getting into low blood sugar. Many a times we have also seen patients who do not cook food on time, and because of that also they have landed up into low blood sugar. So please keep this point in mind. Alright, now it also depends on the duration of a diabetes. See what happens as the diabetes advances, our body's response to the low blood sugar also gets altered. So whenever your duration of a diabetes is more, you tend to have a higher chances of a low blood sugar. Also, due to the advanced stages of the diabetes, there are a lot of changes which happens and which can contribute to something called as an autonomic neuropathy, and that can also causes a lot of issues with the symptoms of the low blood sugar. Many a times, many people have a habit of keeping their blood sugar very tight, and when you try to keep your blood sugar very tight, again your risk of getting into hypo increases because you are very cautious about your diet, you are taking overdose of the medications, you are doing more strenuous exercise, and that can also increases your chance of a low blood sugar. Another reason is a concomitant use of the beta blockers. See, beta blocker medications are very commonly prescribed medicine to diabetic individuals to maintain their blood pressure or to maintain their heart conditions. Now, beta blocker per se does not cause a low blood sugar. However, beta blocker has an impact on the symptoms of the low blood sugar. See, when your blood sugar starts falling down, you will get a lot of alert symptoms, and one such alert symptoms is a suddenly increase in your heart rate, having the shakiness or palpitations, sweating. And these alert symptoms alerts a person that to measure their blood sugar. But when you take a beta blocker medicines, what happens? All these symptoms gets masked. So when your blood sugar starts falling down, you do not get those alert symptoms, and that's the reason why many people miss out on the right timely action. So if you are taking a beta blocker, speak to your doctor. You might need to consider frequent blood sugar monitoring, and you might also need to consider having a small frequent meals at a regular interval. Similarly, if you are taking antidepressant medications like a tricyclic antidepressants, again your chances of getting into low blood sugar increases. Now, besides that, if you are undergoing any kind of a sudden or rapid weight loss, your chances of hypo increases. See what happens, one of the major common risk factor of getting a type 2 diabetes is a overweight and obesity. So the very first lifestyle modification we ask patient to do is to lose weight. And the moment you start losing weight, your sensitivity to insulin also changes. You become more sensitive to insulin. So if you are losing weight and you are going to continue the same dose of the medication what you were taking in the past, there is a high possibility that you will land up in a low blood sugar. So if you are losing weight, you need to speak to your doctor and you might need to readjust your dosage of the medications. There are incidences when people are taking the same medicine for years and years and years and they don't go to a doctor and they don't change the prescription. So if you are one of that, please don't make such mistake and do a timely revision of your prescription, because that can save you from an unfortunate hypoglycemic event. Alright. Now besides that, there are other reasons, and that one of the such reason is the kidney damage. Now see, when your diabetes duration increases, your risk of getting into complications also increase, especially if your diabetes remains uncontrolled for a long period of time, and it can give you a damage called as a diabetic kidney disease. So when you have a diabetic kidney disease, your chances of hypo increases. See, kidney is a very important organ when it comes to the metabolism of the medications. So insulin or oral medicines to treat diabetes, what you might be taking, they gets metabolized in the kidney and gets excreted by the kidney. So if your kidney is not working properly, their excretion will not happen correctly, and this medicine will remain in your body for a long period of time, and they will work for a long period of time, and that can increases your risk of hypo. At the same time, the kidney helps in the absorption of the glucose. So when your kidney is not working properly, this glucose reabsorption will not happen, and again your chances of hypo increases. Similarly, when you have a diseases of your liver, again your risk of hypo increases. See, liver is a very important organ when it comes to the glucose storage. Whenever there is an excess of a glucose in our body, it gets stored in our liver in the form of a glycogen. And the moment when our blood sugar starts falling down, it is this glycogen which breaks down and converts into glucose and gives you energy. So if for any reason, if your liver is not functioning properly, this glycogen storage will not be correct and you can land up into hypoglycemia. Similarly, there is a thyroid imbalance. Now see, thyroid is a very important hormone for our cellular metabolism. So when you have a hypothyroidism, wherein your thyroid is working less than the requirement, so what will happen? The medications which you have taken, their metabolism will become slow, and that can also increases the risk of a hypo. Similarly, when your thyroid is working more than the requirement, what we call it as a hyperthyroidism, here what happens, the whatever food you have consumed gets super fast metabolized, and again that can increases your risk of a hypoglycemia. So all liver, kidney and a thyroid imbalance can also increases your blood sugar. Similarly, if you have other hormonal problems, especially that of your pituitary gland problem, what we call it as a condition like a panhypopituitarism, or when you have a adrenal gland hormonal problem. By the way, adrenal gland is a small gland located on top of your kidney. So when you have these hormonal problem like an adrenal insufficiency, you can develop a hypoglycemia. Similarly, there is one important hormone called as a growth hormone. So if your body is a deficiency of growth hormone, again your risk of hypoglycemia increases. Then there are certain tumors and cancers which can increases the hypoglycemia, and one such a classical cancer is a cancer of a pancreas gland. Now see, pancreas is a very important organ located in our abdomen region. This pancreas secretes not only an insulin but also a hormone called as a glucagon. So when your pancreas doesn't function properly, you can have a hypoglycemia. One such tumor is called as an insulinoma, wherein there is an excess of the insulin hormone secretion. So if you have such kind of a cancer, your risk of hypo further increases. Now then there is a shift of the hormones which happens during the puberty, especially when you are a type 1 diabetic who are children. When they go through the pubertal changes, wherein there are a lot of hormonal changes which is going to happen. So during this phase also they experience a lot of hypoglycemia. Similarly, when a woman undergoes through the menstruation every monthly cycle, your risk of hypo further increases. Similar applies to the pregnancy. See, pregnancy is a big shift of all the hormones happens in the woman's body. So especially during the first 20 weeks of the pregnancy, when the hormone shift is maximum, your risk of hypo further increases. So if you had a diabetes which was present before pregnancy and then you got a diabetes, and if you continue to be on the same medications, again risk of hypo increases. Similarly, it applies to the alcohol consumption. So if you are a person who consumes alcohol on a regular basis, and especially while consuming alcohol, if you are skipping your meal or you are not eating on time, your risk of hypoglycemia increases. Another reason is that if you are not changing your insulin injection site, yes, many people to manage their diabetes take a help of an insulin, and this insulin is used in the injection form. So when you are going to inject the insulin in a wrong way, you will increase your risk of hypo. Now see what happens when you inject an insulin. So it is usually injected in a subcutaneous tissue. So just below your skin there is a fat tissue. So what happens when you keep on injecting insulin at the same site again and again? So there is a lot of fat deposition which happens, and there can also be start developing a scar. So both this fat and a scar can make the insulin absorption a little tricky, and it can lead to a condition called as a lipodystrophy and a lipohypertrophy. In both this kind of a situation, the absorption of the insulin becomes erratic, and because of that, you will find that there is a lot of fluctuations in your blood sugar. At times the sugar levels will remain very high, at times the sugar level will remain very low. And then when we see the patient and when we examine the site of injection, we find that these patients have developed such a condition. So if you are taking insulin, make sure that you keep on changing your site of the insulin. Also, it depends which body area you are injecting insulin. Now, when you inject insulin over your abdomen, the absorption of the insulin is faster and the action is faster. Similarly, when you inject the insulin in your buttocks, the insulin utilization becomes relatively slower. So, this point also needs to be kept in mind. Again, hypoglycemia risk increases to those people who have got any kind of a digestive problem, especially that of your nausea, vomiting, then a loose motions. So when you are undergoing through such kind of an acute GI discomfort, your risk of hypo increases. Your risk of hypoglycemia also increases when there is a change of the weather, especially in a hot and a humid climate. Hypoglycemia increases. Similarly, if you are staying at a higher altitude like that of a hill station, again your risk of hypoglycemia increases. Hypoglycemia also increases if your body has undergone through any kind of an acute response. Now, acute stress response, like an example, a case of a surgery or a hospitalization or an accident, our stress response gets altered and you can have a low blood sugar. Hypoglycemia risk also increases, especially if you are taking a steroid medication. Now see, many people for many health conditions take a steroid medicine. So suddenly if your steroid medicine is stopped, or suddenly if your steroid medication dosage is decreased, and if you have not done the changes in your insulin or oral hypoglycemic medicines, your risk of hypoglycemia increases. So do speak to your doctor if you are taking a steroid medication. Similarly, there is something called as a polypharmacy. Now see, diabetic people, they don't have diabetes alone. Many times they have other health condition, and a blood pressure is one such common condition. To maintain this blood pressure problem, many patients are prescribed drugs which belongs to the class of ACE inhibitor and ARB, that is angiotensin receptor blockers. By the way, this class of medicine is the most commonly prescribed medicine. So when you are taking such polypharmacy medicine, again your risk of hypoglycemia increases. Likewise, if you are taking any medicine like allopurinol or probenecid, which we commonly use for management of your high uric acid, your risk of hypoglycemia increases. Warfarin is another medication which we use it for a heart problem, and if you are taking such warfarin, again your risk of hypoglycemia increases. So these are the certain major reasons why your risk of hypoglycemia increases. Now besides that, then there is a food mismatch. Especially this happens to the people who are elderly population and to the young children, where they have a very erratic eating habits. Many times they skip the meal, many times they eat less than the requirement. That can also increases your risk of hypoglycemia. Especially in a type 1 diabetic children, they have many times they throw a lot of tantrums that they don't want to eat food. They have taken insulin, they have not eaten food, maybe they don't like the food, so they skip the meal. Again the risk of hypoglycemia increases. Many times they have taken an insulin, they went out for food, maybe they've gone to a restaurant, the food came late or they got some delay for whatever reason, hypoglycemia risk increases. Similarly, type 1 diabetic children, they do a special kind of a monitoring called as a carbohydrate counting. So when they don't do the carbohydrate counting, again the risk of hypoglycemia increases. Nowadays, in order to maintain a good body weight, many people have landed up into something called as an intermittent fasting, wherein you are not going to eat for a prolonged period of hours. And if you are observing an intermittent fasting, and if you are taking insulin or other class of medication, your risk of hypoglycemia increases. So speak to your doctor. Again, a prolonged fasting for many reasons, probably for a religious reason like a Ramadan fasting, or many times the person is undergoing some kind of a medical procedure wherein they have to remain in the fasting state for few hours. Again the risk of hypoglycemia increases. Risk of hypoglycemia again increases if you have undergone any kind of a recent hospitalization, or if you have any kind of an infection, or if you have taken some kind of anesthesia in the recent past. Again the risk of hypoglycemia increases. Again, risk of hypoglycemia increases if you have not taken the dosage of the medication correctly. By mistake, if you have taken more than the requirement dose, wrong type of insulin, or wrong timing of the insulin, all that can increases your risk. Again, the risk of hypoglycemia increases if you are doing sudden changes in your physical activity. Suddenly you increase your intensity of exercise, or suddenly you increase the duration of exercise, or suddenly you just start your exercise. All that can increases your risk of hypoglycemia. Unwanted and unexpected physical activity, such as like walking in the garden or in the mall or in the marketplace, again risk of hypoglycemia increases. Even at times the nighttime sexual activity causes a lot of exertion and can also increase the nighttime low blood sugar, what we call it as a nocturnal hypoglycemia. So these are all the major reasons why a person who has a diabetes can have a higher tendency of getting into hypoglycemia. I hope after watching this video you got some good useful information, and if you like the video, please click on the like button. If you are new to my channel and if you have not subscribed to my channel, please subscribe so that you get more and more health related information. And if you have any of your personal question, then don't forget to write that in the comment box. I will try to answer them as early as I can. And then there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification so that you don't miss out on a valuable information. Alright, I hope to see you soon in our next video with some interesting topic. By the way, just to let you know, this is our hypoglycemia series of the videos, and this series doesn't end there. There are plenty many other videos. You can watch that so that you are completely well versed with the hypoglycemia. Hypoglycemia is a one such incident which can happen if once in a lifetime of a diabetic person. That person never forgets, because that can be that dangerous. So knowledge is power, and to make you a more powerful, I have made this special series so you can take a full advantage of that. I'll see you again. Till then, take care of yourself. Namaste.